Good morning, everyone. Hope everyone's having a good morning so far. Welcome to week 3 of our Cardio-ECHO series. I will go ahead and just get started on our reminders, and then we'll jump into the agenda for the day. So as always, if you could please go ahead and chat your name and your practice name into the chat feature, that just helps us record attendance. And then feel free to use the chat at any point throughout the session to ask questions, make comments. And then when we get to our Q&A sections or the case discussions, we really just encourage you to go ahead and unmute yourself. Feel free to contribute to the conversation. And then if you need to get a hold of anyone on our team, any sort of IT support, please contact Rick. His info is there on the screen. And then any sort of general comments or questions, again, feel free to always reach out to me or our facilitator, Dr. Rao. And with that, I think I'll go ahead and just turn it over to Dr. Rao and we'll jump into the agenda.
Thank you, Jesse. And thanks to everyone for joining us for week 3. We've got 2 great cases and an excellent presentation by Dr. Taylor to come. So I am Gautam Rao, the facilitator, the director of the ECHO program for cardio. Our lead discussants today will be Doctors Taylor and Werner because the cases are most relevant to their expertise. So after each presentation, I'll ask Chris and Jim to make a few comments, and then we'll open up the discussion to everyone else. Our presenters are going to be Dr. Clemens and Murphy. And prior to their actual case presentation, I'd like to ask them to both introduce themselves and tell us a little bit about their practice before they jump into the details of 2 really, really interesting cases. So with that introduction, I think, Chris, you can take it away with your presentation.
Great. Thanks, Dr. Rao. Again, welcome everyone back for week 3. What I'm going to talk about today is how we address lifestyle approaches within diabetes and also how it's related to cardiovascular risks as well. One of the common things when I talk about how we address lifestyle behaviors and those recommendations, depending kind of regardless of which recommendations that you're getting, whether it be diabetes, heart disease, cancer, they all have a lot of the same central themes and play very well together in the sandbox around what those implications are, what our recommendations are, and they're fairly consistent. So what we're going to talk about today, we're going to look at strategies for initiating discussion around lifestyle behavior to better promote diabetes as well as cardiovascular outcomes, effective ways to promote physical activity among patients, and then talk about how lifestyle behavior modification can impact outcomes of chronic disease. So I always like to start within the discussion around how do we manage chronic disease outcomes with nutrition and physical activity, with kind of looking at the gears together of we have pharmacologic treatment, and then we have lifestyle behavior modifications. And if you look at the treatment guidelines across all the different chronic diseases, there's a lifestyle management first, and then moving forward with pharmacologic treatment as needed, usually necessitated. But a lot of times the lifestyle behavior is a bit underutilized within the grand scheme. So, Rick, next slide, please. And how I'd like to kind of personify this is in terms of management of diabetes. We're looking at high blood glucose, and we're using pharmacologic treatment to try and bring down our high blood glucose level. And if we don't address the lifestyle behavior, it's kind of like we've all just come through summer in Ohio. We know what it's like when it starts to get hot and we start to get warm, so we start turning up the air conditioner. Well, you can continue to turn up the air conditioner, but if you don't close the window where you're letting all of the heat in, the house is never going to get cool because your air conditioner can only do so much to combat what is coming in. So our poorer insulin production and poorer insulin action is going to be working against us in terms of managing diabetes. But if we don't manage the influx of carbohydrate and the amount of blood glucose that we actually are generating and circulating, we're going to constantly be fighting a losing battle. So really pairing together that lifestyle behavior modification with diabetes, whether it be reducing carbohydrate intake or simple sugar intakes, or physical activity, which will help in a non-insulin dependent way lower blood glucose, which then these issues are going to lead further into cardiovascular complications. So if we're starting at the launching point, this excess carbohydrate now then becomes converted into triglycerides for storage, and now we end up with issues of obesity and cardiovascular disease risk. So next slide, please. So really starting to think about the path towards lifestyle behaviors. And as I mentioned, our guidelines are really focused on this link between utilizing lifestyle behaviors within two pharmacologic therapies. But patients often perceive that medication is basically going to cover their needs. So, okay, I've got this, I've got a medication, I can take that, so now it kind of gives me some liberties for what else I can do because my medication is covering things. And with some of the work that we've done around linking patients in primary care to dietitians and nutrition counseling, what they told us was they knew lifestyle change was something that they should do, and they knew it was something that was important, but I'm taking this medication, I'm okay. But it really wasn't a priority until their primary care provider said, I'm concerned about your diabetes, I'm concerned about your hypertension. I think we should focus on lifestyle, and would you be willing to meet with a dietitian? And that was what made it real for those individuals to actually take action and move forward with lifestyle change. Next slide. So in terms of providing this guidance, we all know how easy our food choices come to us in terms of kind of what we do, what we know, what we're used to. So, and we've been doing these for a longer period of time, and when we start dealing with chronic diseases, especially in older adults, you have people that have had these behaviors for pretty much all of their life. So the change is not just going to be as easy as I want you to eat these, I want you to drop that, and now everything is going to be simple. As we've talked about many of the social determinants of health, there are a lot of factors that go into individuals' lifestyle behaviors. So it's going to require a little bit more time investment in really being able to make big changes in individuals' lifestyle behaviors. So the U.S. Preventive Services Task Force recommends moderate to high intensity lifestyle behavior change of 31 to 360 minutes or up to over 360 minutes of lifestyle interventions to really facilitate meaningful lifestyle behavior change in individuals, which requires us to work together as a team. And in some cases, you don't have to be the sole provider of the lifestyle behavior change, but if you have referrals that you can make, now you can become the reinforcer for that information and continue to provide that support and guidance that will help move people towards these behavior changes. And we have a lot of different guidelines around lifestyle behavior. A lot of them focus on reducing added sugars and carbohydrates and these sorts of things. But what it ultimately means is we have to convert this to what people eat. So we need to convert these guidelines from recommendations on nutrient intakes and overall food intakes from a day to a week to what do people eat at foods? What do people eat as meals? And how do we translate this big picture from I want you to reduce your added sugars down to the added sugars you seem to be getting are from regular soda. How often do you eat it? And how can we bring these? How can we reduce these? When are you drinking these? At snacks, at meals? And how can we convert that from what our overall recommendations are about food? And how do we get it down to the day-to-day actions for the average patient? Next slide. So part of the work that I do around dietary intakes is there's been a lot of nutrition science that's really focused on average calories and average carbohydrates and total amounts of added sugars. But a lot of the work that I do really kind of boils down into making meals matter, because these are ultimately the eating times where people sit down and have their cumulative intakes for the day. So we have a total amount of carbohydrate we eat for the day. But if our recommendations are to spread that carbohydrate out throughout the day, spread out our protein, spread out our fat throughout the day, for both diabetes and for heart disease outcomes, as well as successful aging, really getting down to the meals becomes an important situation for how we translate our recommendations into daily behavior change. And what this also means is that we need to address both foods and beverages, because what we eat becomes important, but what we drink becomes equally important, especially when we're managing diabetes, which then is related to cardiovascular disease, that we get a lot of energy, carbohydrates, and added sugars that come in our beverages, whether they be in the form of sweetened beverages, whether they be in the form of what we add to our coffee. But the quantities and contributions that people have from their beverages are often underappreciated. Next slide, please. And then the other unsung hero or villain, depending on how you look at it, within our diets, are the snacks that we eat. A lot of times we're talking about, I want you to eat 3 meals a day. I want to make sure you're eating breakfast. I want to make sure. But in reality, Americans get about 20 to 25% of their daily intakes during snacks. So snacks are essentially serving as a 4th meal for individuals' intakes. So they're contributing considerably to overall intakes. And also a very big contributor of added sugars during snack times. So in looking at these broader pictures around how people are eating throughout the day, focusing on meals, but then also focusing on those in-between snacking times and how those are really contributing to the total day and overall diet quality. Next slide, please. And then quickly, I also want to talk a little bit about physical activity recommendations and getting people active. Many of these fall under that same category with what we had with the lifestyle under dietary changes. Is they know it's important. As a dietitian for over 20 years, I've heard I know what I'm supposed to do, and I've got a treadmill in my basement, but that's where I hang my laundry. So it then becomes, how do we facilitate the motivation and how do we get people to prioritize the activity? Our recommendations are around 150 minutes per week of moderate activity or 75 minutes of vigorous, but also including in 2 to 3 times a week for some resistance activity on non-consecutive days, but also including flexibility and balance, which will help with muscle stability, will also help with balance, especially later in life for risk of falls. And really then limiting that screen time, promoting movement every 30 minutes, and limiting that sedentary time where we're sitting and not moving. And looking at creative ways that we can get people engaged to overcome some of the barriers of, I don't want to exercise. Because we see exercise often as, I've got to do organized sport or I've got to go to a gym. But really looking at ways that we can be active. Maybe it's gardening, maybe it's dancing, maybe it's social activities where we go walking with friends, as ways to get us out of the exercise mindset and getting us into the active mindset. There was an episode of Biggest Loser where they were training them all to be prepared, and then they took them out camping, and they basically were sitting around. It's like, well, we can't exercise because we don't have any equipment. And eventually somebody said, we can walk. So they started walking around, and then they started to make the realization that you don't have to be in a gym and have exercise equipment to be physically active. Next slide. So one of the areas where we've seen challenge in terms of the evidence growing in certain topic area or in around lifestyle behavior is the ability to get bigger studies funded that will look at lifestyle behavior as a treatment. It's the lifestyle is important. Yes, we all know that. But by how much? Well, it's harder to get the studies funded for something that we already know, but we need the evidence for. But the diabetes prevention program, as one of our earlier studies, was kind of a hallmark around addressing lifestyle behavior and what these implications were. This was for preventing the onset of diabetes in essentially at that time impaired fasting glucose or prediabetes. And it was really a test of the drug metformin versus usual care. And when they designed it, they ultimately said, well, what is usual care and what should it be? So the lifestyle behavior modification group became a secondary control group for this study. And it was twice as effective as the medication they were originally intending to test. But what it really showed were these long-term outcomes from 5 to 7% of body weight lost as a function of lifestyle behavior change, and the litany of changes in both diabetes and cardiovascular risk factors that really held true for 10 to 15 years after the study was conducted. So it gives us some of our strong evidence, and ultimately in a study that was considered to be a drug trial, became a strong testament for the impact of lifestyle behavioral medicine. So with that, I will stop. So I'll take any questions.
Thank you, Chris. Great presentation. Any questions for Dr. Taylor before we move on? Probably have time for one or two questions. Let me just check our chat to make sure. Okay, I think we are good. So Rick, can we move on to our case studies? Last word back to Jesse, please.
Sure. So thanks, everyone. Just a quick reminder that we do post the recordings of the didactic presentations on our website. You would need to register on cardio.org to make an account. If anyone has any issues doing so, please just let us know. We're happy to help. And then just a final reminder, you should have your post-clinic survey in your inbox for today's session. The feedback on those has been great and very helpful, so please continue to fill those out. And with that, thanks to everybody, and we'll see you next week.
Thanks, everyone. Have a good week.